Good morning. Today on The Rose Lee Show, we will explore the benefits of taking on a personal commitment to engage in our healthcare and that of our families so that we can increase positive healthcare outcomes and all enjoy a greater quality of life. It's that time of year again to have fun in the sun. But take notice, according to the Center for Disease Control and Prevention, lice and parasitic insects can be found on people's heads and bodies. Human lice survive by feeding on human blood. And that sounds scary to me. So parents, don't let your guard down during the summer. Head lice love warm weather, so it's a perfect time to have a plan of action against this childhood nuisance. Joining us this morning is nurse practitioner Wendy Wright with some important advice for parents on how to prepare for a possible lice infestation. Good morning, Wendy.
Good morning, Rosalie, and thank you so much for having me on today.
All right, so Wendy, tell us about head lice and why they are more active in the summertime.
You know, it's very interesting, and I'm not sure that any of us really understand fully why it is that we see head lice in certain communities. What I will tell you is that some of the studies have shown that head lice are actually able to live further away from the scalp in areas that are warmer, and that enables, and you mentioned it, that lice, in order to continue to live, need to take what we call a blood bath, which is actually a feed off of the scalp. I know that that's very scary to your viewers, but what I really believe is important to take away is that head lice are common no matter where we are, and they're common in school-age kids. There are 6 to 12 million infections every single year, or infestations with head lice, particularly among school-age children. So while that sounds really scary, that statement from the CDC, we've had head lice for hundreds of years.
And we lived through it.
And we have lived through it. Yes, we have.
All right, so tell us some myths and facts about head lice and its impact on a family.
We know that head lice are the most common, and they actually occur, interestingly, on healthy hosts. They appear in clean heads, and I think your viewers need to know this because there's often a lot of stigma that are attached to head lice, and head lice really love clean, healthy heads, often what we see with a lot of our school-age children.
So tell us, how do children spread head lice?
So the most common way that head lice are spread is by a child putting their head up against another child's head. So we commonly will see the spread in sleepovers where kids are sharing the same bed. You know, school-age kids don't know, keep your head back from other kids. They're frequently hugging them, their heads up against each other. That's how it's often spread. Now, I know a lot of parents get very worried about baseball caps. I know they get worried about combs and brushes. And while that can spread head lice, it's not nearly as common as putting our heads up against someone who's infested with head lice.
All right, so Wendy, share some of the best treatment options that are available.
So there are approximately 6 or 7, I think there's 7 now, different treatment options. 2 of them are available over-the-counter, 5 of them are available prescription. The over-the-counter provides access to people, and they're able to buy those without necessarily consulting with a healthcare provider. They can go, they can treat their children. The issue with the over-the-counter meds is they need to treat their child, they need to comb out nits, get rid of the nits, and they need to repeat that treatment 2 weeks later. We also have 5 different prescription products available, but I've partnered today with Arbor Pharmaceuticals to talk a little bit about Sklice, which is one of our treatment options that's available. For instance, this is a 10-minute application of lotion onto a child's head and scalp. We don't have to have the parents comb out nits. We do still tell them, you know, you should still clean your brushes, clean your hats, but they're able to treat their child for 10 minutes and be done with it, which is really great. And if your viewers are interested in information about it, they can certainly consult sklice.com for additional information on head lice and the full prescribing information.
So should parents contact their local health department or healthcare provider?
They can consult the cdc.gov, they can go to slice.com, or they can call their healthcare provider. I think all of those provide, and this is the key, they provide evidence-based recommendations for their patients. And I think that's important. There's a lot of myths and a lot of treatments out there that are not necessarily based in science, and they may not be safe for your viewers. So consult your provider, consult the cdc.gov, and I think both of those locations will provide them with some great information.
Thanks, Wendy, for joining us this morning and sharing with our viewers how to prevent and treat head lice to protect our entire family.
Well, thank you so much for having me. I really appreciate it.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
Over the last 2 decades, the number of Americans with kidney cancer has risen each year. This year, approximately 63,000 new cases of kidney cancer will be diagnosed in the U.S., with an estimated 15,000 deaths. The most common type of kidney cancer is renal cell carcinoma, known as RCC. It accounts for 90% of adult renal malignancies and generally affects people between the ages of 50 to 70 years old. Those affected by advanced RCC have reason to feel hopeful due to recent new scientific advancements. Joining us this morning to discuss new treatment options available to some patients with advanced kidney disease is Dr. Sabby George, an associate professor of oncology at the Roswell Park Comprehensive Cancer Center. He specializes in treatment of kidney, bladder, and prostate cancers. Alongside Dina Battle, the president of the Kidney Cancer Research Alliance. Good morning to both of you.
Good morning.
Good morning.
Thank you for having us.
So, doctor, tell us about renal cell carcinoma and how is this type of cancer diagnosed?
Renal cell carcinoma, or the commonest type of cancer in the kidney, which is a fatal disease. This could grow into a big tumor in the back of the abdomen till it is found out. So it could evade the finding of a tumor in the back of the abdomen for a long time. The commonest type of symptoms or signs include flank pain, blood in the urine, or a tumor or a mass in the back of the abdomen on palpation or examination by the doctor. So these are signs and symptoms of kidney tumors, and that's how it gets started or it gets investigated initially.
Research shows when kidney cancer is diagnosed at an advanced stage, almost 8% of patients live beyond 5 years. And their prognosis is even worse in patients with certain risk factors. Tell us, doctor, what are those risk factors?
So there are risk factors used for classification of patients into risk grouping. There are 2 main types of risk grouping. One is called the IMDC database risk grouping or prognostic scoring system. And then the other one is called the MSKCC risk grouping. These are some factors which are changes in the blood tests or changes in their functional status, and also the recurrence of the tumor after having the primary surgery for removing the kidney tumor. So these are basically broad classification of risk grouping, and they get grouped into favorable, intermediate, and poor risk based on the number of factors that they have. And then the outcome also varies based on these risk grouping.
So what's the reason kidney cancer is on the rise?
We don't know the exact reason, but in the past 2 decades, the kidney cancer incidence has been on the rise. But that being said, I could talk about some of the causes of kidney cancer which are known, and there are some unknown causes. The known causes of kidney cancer include hypertension, obesity, certain exposure to certain chemicals, and smoking. That being said, there are a lot of unknowns, and there are some familial type of kidney cancers which are transmitted from parent to the child. And so we don't know the exact reasons, but again, unfortunately, this is on the rise, and it's a fatal disease, and there is an unmet need to develop newer treatments.
Now, Dina, as an advocate, share with us why you started KC Cure and what motivated you to be an advocate.
So the Kidney Cancer Research Alliance, or KC Cure, is a grassroots organization of patients and doctors that came together to increase awareness. It's actually kind of a special story of how we started. I lost my husband to kidney cancer in 2009, and I joined together with Dr. Hans Hammers, who was the oncologist who treated my late husband. And we really wanted to increase awareness and increase research funding and make sure that no other family had to go through what my family had to go through.
Well, I'm sorry to hear that, but tell us about your work as an advocate.
So we work really hard to increase awareness and education about the disease. We also provide research funding to those who are doing early seed funding research in kidney cancer. And we also encourage patients to connect with other people who are dealing with the same diagnosis, just so that they have a sense of community and they can talk to others who are managing this disease.
So, Dina, how old was your husband when he was diagnosed?
He was young. He was 40 when he was diagnosed, and it was a really shocking, horrible time for us. And as an organization, one of our hopes is that we can provide some of the educational material that wasn't available to us when my husband was diagnosed. And we're really grateful to industry partners like Bristol Myers Squibb who have helped us to provide that type of material for others who are dealing with this.
Great job as an advocate, Dina. Dr. Dina's husband was younger, but what I've read, most patients are affected in their older years.
Not really. So it usually mostly affect people between the ages of 50 and 70. That being said, I still treat a lot of people who are younger affected by kidney cancer.
So, Doctor, a new combination therapy was approved by the U.S. Food and Drug Administration to treat certain people with RCC when their cancer has spread. Why some people? So,
the recent approval by FDA is a combination of Opdivo and Yervoy, which belong in the class of immuno-oncology drugs. That being said, I'm a clinical investigator, and I'm a paid consultant of BMS as well. That being said, I'll tell you a little bit more about the combination treatment. These two drugs together, they can activate the immune system, which is turned off by the cancer. And the immune system goes and fights the cancer. That's how this works. And the trial, Checkmate 214, demonstrated that the combination of Opdivo and Yervoy can shrink a tumor in a higher percentage of patients, as well as can make the kidney cancer patients live longer compared to the standard comparator, sunitinib, on that trial. So this is wonderful data. And also, 9% of patients who are treated with the combination went to what's called a complete response, meaning complete resolution of the tumors that they had.
All right, Dina, so what advice do you have for those living with RCC?
Two big messages. One is stay hopeful. New treatments like this are very exciting and give lots of reason to be hopeful. Two, be educated about your disease. We encourage folks to visit our website, kccure.org, to get more information. And also Opdivo.com is an excellent source of information about this new and exciting combination therapy that's available to patients with advanced RCC.
Thank you, Dr. George and Dina, for joining us this morning to share new cancer treatment options and the support resources that are available to those living with kidney cancer.
Thanks for having us.
Thank you for having us.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
The National Health Expenditures projections report Americans use preventative services at about half the recommended rate. And under current law, national health spending will grow an average rate of 5.5% per year from 2017 to 2026. And it's going to reach $5.7 trillion by 2026. Though Americans think our nation is technologically advanced, unfortunately, digital health is way behind, unlike banking, finance, and social media. Healthcare hasn't changed in nearly 20 years, and Americans are paying the price. Joining us this morning to disrupt the current norm of healthcare and transform change in the digital health space to provide better healthcare to patients is Dr. Naveen Goel. Good morning, doctor.
Good morning, Rose. Thank you for having me here.
All right, doctor, you created a new mobile platform called HealthCosts. What is the mission of HealthCosts, and why did you decide to create this product?
Personally, everybody's getting old. We will get sicker over time, and we need to personally have to improve this healthcare, not for us, along with everybody else. And I see practicing in India, practice here as a primary care, then nephrologist, that this gap is causing so much trouble. Personally, I've spent hours and hours trying to figure out the information which could be given to me in a click of button. That can reduce the time we treat the patients. We can provide the quality of care to the patient. Just having the information on our fingertips can change the whole spectrum, how we practice the medicine. That's why I wanted to build a technology platform to do that. Communication and connecting the patient to your doctors, to their family, so everybody is on the same page, not on pages.
So describe more about the HealthCosts platform and why it's designed to coordinate the involvement of both the patient and their family.
HealthCosts connects the patient to the family and to the doctors, utilizing automated algorithms. For example, if you're diabetic and you're checking your sugar and sugar goes to, let's say, 50, 60, you're still not there, not feeling good. But we know that below that sugar levels, you may be feeling sick. By the time that number reaches 50, 60, the doctors gets notified, your family gets notified, and whosoever can get to you and help you provide the help. You may or may not be able to realize that, hey, sugar is 60 because you're already feeling sick. HealthCosts platform will connect to you, everybody, and provide that support. But as a lazy Americans, we need to own our own health and take care of it.
So how is HealthCosts disrupting the norm in the healthcare industry?
Rose, because we need to disrupt this change. We can't afford this increasing cost of healthcare, which is going to $5.6 trillion. What does it mean to me as a patient? What do I care? We do care because this healthcare insurance premium we pay one way or another. It's coming from our pocket. And 40% of healthcare budget is waste. And with this HealthCosts technology platform, we're bringing this engagement piece where the physician was a part of the community. Same, we're using technology to bring that relationship back. We can actually tell the patient what they're supposed to do and track, and whether they're doing or not doing. Whether I say to you that as you get older and you're getting so many things going along with you, forget to take your medication. These kind of systems can tell you, hey, take your medication and keep the compliance going here, remind it to you. And if you are falling out of zone where your sugar is running too high and low, before you call the physician, somebody's reaching out to you to provide that help. This is where it's disrupted, where before the patient thought that, hey, I'm not feeling good because my sugar is running low, I'm going to go to hospital, somebody's calling and providing that feedback, treatment protocol. So now the whole angle of getting the care in hospital has changed. Patients are doing much better at home because they have a support system built using a technology like HealthCosts. And that is the future.
All right, doctor, so what you're saying is that the medical community will better serve patients to produce a positive healthcare outcome through a mobile component that monitors a patient's engagement to follow their doctor's orders so that the patient's engagement will improve their decision-making, compliance, and overall better quality of care.
Yes, absolutely.
Doctor, do you think more patients today take on a proactive approach to their own wellness?
From my physician experience, sadly, answer is no. But do they want to take the proactive role? Answer is yes, but they lack the tools to make that happen. Let me explain you this 60-30-10 rule. 60% of the patients are healthy and they do not have much disease, and they're well and they can proactively engage. 30% of patients, as the disease is progressing and they have multiple chronic conditions like diabetes, hypertension, they need more hand-holding and need support. And the last set is 10% of patients when the disease is really progressed and they're moving faster because we are not taking care of or engaging those patients in this disease spectrum from 60 to 30 to 10, and they consume 70% of healthcare budget. And if we can engage this patient, this disease progression will be slower and less hospitalization, and we can improve the quality of care.
All right, share with our viewers the benefits engaged patients enjoy versus those who do not take responsibility for their own healthcare outcomes.
First of all, when they're engaged with their physician, they have much more trust in the system. They are able to reach out to the physician if they have a problem. Right there solves most of the problem of utilizing the hospitals, ERs, just for everything. And that increases the cost. Once they have that trust and engagement piece built with the physician, that cost will go down and they will feel that they've been supported in their health care and they can do better at home and there is no need to rush and there is people who can support. So that builds a very strong trust foundation between the patient and the physician. And the physician feels the same way because in the end, the physicians are also patients.
As a physician, do you recognize barriers in the healthcare industry that patients may not realize?
Definitely is the flow of information between the patient and the doctor and the patient and different doctors. Patients may not realize that this information is not transferred or shared among different people because it's a very doctor-centric situation where the information stays with the patient, and patients usually do not have any kind of information about them. They have to recollect everything from their memory. And actually it should be other way around, where the patients should have their information and should share with the rest of the treating entities so that it can be managed better. Because in the end, the person who provides most of the information is the patient. And the person who does not have that information is the patient. So that needs to be changed at the situation.
So who should be driving the change in healthcare?
I'm glad you asked that question. I think everybody should drive this change. And the reason, first I'll give you the reason, and is healthcare is expected to reach $5.6 trillion. Not only, where is this money coming from? Actually, we as a patient or as a physician, everybody in the end pays for that health insurance. We can't afford this. So first piece is, yes, we cannot afford and we can drive the change because 40% of healthcare is a waste. And with this engagement, patient, doctors, healthcare organizations, payers, everybody has to work through this to make it possible, not only to save the money, to provide better care. In the end, everybody desires to be healthy.
So why is it so difficult to achieve success in patient engagement to improve their decision-making, compliance, and overall better quality of healthcare?
I think the most difficult part is getting the information out there. And I'm glad you're helping that because as you talked previously, that we are technologically 20 years behind when the counterparts in automotive industry or financial industry. We are catching up to it. We have technology tools like Health Costs, which can disrupt and help provide, but we have to get that word out to the patient that they are aware that there's a technology they can use to live in the current times or do better. Similarly, the physicians are too bogged down in taking care of the patient. They have no idea that this technology exists and they can take care of the patient. I think if we can spread the word and the patients are asking that, hey, we need to use and we have to do this, This will drive forward. This will happen, and we will take care of the patient in a much better way, both sides.
So, all right, so tell us, what's the distinction between health costs and other healthcare digital platforms?
Rose, I'm glad you asked. Health cost is an end-to-end solution which encompasses everything which is out there, which requires the patient to manage their health and connect with the family in a very automated fashion. As a physician, I know when I see the patient what they're supposed to do. On the other hand, as a patient, also I understand what I need from a physician. So I put everything together in one place so that patient does not have to think through. All they're supposed to do, they are doing, but using technology. And it helps just to improve the quality of life they can live with it. They don't have to run to the hospitals, to the urgent care. The help and support is inbuilt.
So how will health costs make a real difference in a patient's life?
As a patient, this is what you need. For example, if you're diabetic, hypertension, what you're doing now is taking those readings, write on the piece of paper, and bringing to the doctor, if you remember. This technology, all you have to do is take the reading, it gets automated, logged in. So the burden of remembering, writing is all gone. It becomes easier. It provides the support in case your blood sugar goes down, if your blood pressure shoots up too high. And as a physician, I really don't need your paper to comprehend. I already know, before even you walk to my office, I have everything about you. We can have a very candid discussions about your problem, not what you did at home, whether you took your medication or not. We, as a physician, already know what you are doing at home. All the discussion is how you can improve upon it, what medication you can change, and how can you live healthier life, not trying to figure out what you did and what you did not do. The compliance is already established. You can check out our website, www.healthcosts.com. Health Costs, KOS is with KOS, and you can reach out to us, and we will provide you more information, anything you need.
Thank you, Dr. Goel, for joining us this morning and educating our viewers to the importance of disrupting the norm of healthcare and transforming technological change to provide better healthcare services and better patient outcomes.
Thank you, Rose, for having me here.
It's our personal responsibility to protect our health as well as our loved ones by engaging with our medical providers. Advancements in medical technology monitoring systems help measure a patient's success in healthcare through their positive healthcare outcomes. Share with us the success of your positive healthcare outcomes by following your doctor's orders at facebook.com/Rose Lee Show, and follow us on Instagram @The Rose Lee Show. And watch this episode and many others right here on Discovery Life or 24/7 at RoselyArcherShow.com. Thanks so much for joining us this morning, and we do look forward to seeing you soon.